Hello and namaste. Welcome to the JNMA podcast, where we discuss articles that are significant in the current context of healthcare. I am your forever host, Lisasha, and today I am feeling extra excited and a little bit nervous because we have a very special guest with us, someone who has been my mentor for the past 5 years. Today, we will be discussing an article titled Evaluation of Self-Vision Assessment Charts in Schools of Eastern Nepal, a multi-method study, an article where I also had the honor of being a co-author. And to make this discussion even more special, we have the primary investigator of the study and my mentor, Dr. Archana Shrestha. Dr. Archana is an epidemiologist and associate professor at Kathmandu University School of Medical Sciences and an assistant professor adjunct at Yale School of Public Health. Dr. Archana, thank you so much for joining us today.
Thank you, Lisasha. Thank you for the wonderful introduction.
So, to start off, let's dive right into the topic. This article looks at the use of self-vision assessment charts in schools across eastern Nepal. I remember I joined the study when the proposal was already designed, and I was mostly involved in data analysis and report writing. But I still remember the excitement I felt when I first heard about the project, especially since it addressed such an important issue in school health. So, Dr. Archana, what initially drove you to pursue this research? Was there a personal or professional experience that inspired you to focus on vision impairment among school children?
Yeah, thank you for the question. I had, I think, like two basic motivation. First, I am always drawn to evaluation study because that's what I have been trained for so many years.
Mhm.
Because I do a lot of implementation research, and I had been working with the large eye care service provider in Nepal, and we have been talking about many health related projects that they have been implementing in different parts of Nepal, basically the community-based projects. And it just ignited me. The interest just came to me to see, well, they were doing so many activities and had not evaluated that those in a very systematic way. So I was very intrigued to see what was the actual impact or effect of the specific interventions. And one of those interventions were self-vision assessment charts. So that's how I got into this.
Mhm. Yeah, it's always fascinating to hear how personal and professional experiences lead a researcher to tackle such big issues. Now, let's talk about the feasibility aspect. This study was quite comprehensive using both qualitative and quantitative method. So could you share some of the key feasibility challenges that we encountered while conducting this research?
Yeah, as you mentioned, this was quite a large study, and we had planned it. Initially, we planned it to do it in like 3 months, and after receiving IRB, we also like when we went into the field, we realized that um, the data collection didn't only depend on our plan.
Mm-hmm.
It depended a lot on our respondents' daily routine and what they were doing. And since we were working very closely, we had to like collect data from different schools. We
Mm-hmm.
had to follow the academic calendar of these schools. So, first time when we went there, the schools were closed because of some long-term vacation. They had, I think, the break because after a certain exam, so we had to like wait for that. And then even
Mm-hmm.
after the school opened, sometimes the students were busy with their examination schedule. Sometimes like teachers were busy, so it took us a while to learn that and schedule data collection days for all of these different schools. So I think that was one of the things. And second, so by the time we figured it out, we had the data collectors who had committed us only for 3 months. So we also had to like hire more data collectors, retrain them, and send them back to the field. And then at that time, initially we hired data collectors or let's say investigators from like different parts of Nepal. But then we realized that we need a lot of feasibility and flexibility in data collection. So then we focused on hiring collectors from the same area, and then that made our um, field work a little bit smoother.
Mhm. Yeah, I still remember how we managed to achieve effective outcome from the findings in a cost-effective way and within the set time frame. So moving on to the novelty factor, I think this study brought something truly unique to the table. For our audience, could you highlight the efforts you put into understanding and ensuring the novelty of this research?
Mhm. So the subject matter itself is a pretty novel um, idea. It was to implement the self-vision assessment charts. So the organization I partnered with, they had implemented the self-vision assessment chart that they painted in different walls of different schools, and also provided orientation to school children. So the expectation was the school children, especially those who were in the higher grades, like six and above, they were expected to use that self-vision assessment chart and identify if they had any refractive error, and then go back and talk to their teacher or school nurse.
Mm-hmm.
I think that
Yeah.
concept itself was pretty innovative. It has not been well tested in context of Nepal. And second, I would also want to highlight a methodological innovation in this study. This was a multi-method study, so we included both quantitative and qualitative method, and it was done pretty comprehensively. We didn't just analyze or evaluate the effectiveness, like whether or not students were using, and like after they used it, what was the outcome. But also we wanted to measure the process outcomes. For example, was it feasible to implement in that context, and were students able to do it correctly, like fidelity. So I think that the innovation comes in both the subject matter as well as methods part in this study.
Mm-hmm. That's really insightful. Now on the topic of ethics, when conducting research in schools with young children, ethical consideration are paramount. So could you share with our audience the ethical challenges that we faced while conducting this research, Dr. Archana?
Mhm. Sure. So we were working with both students and teachers. So teachers were adults, so it was pretty straightforward. But however, with students, we had to be very, very careful about getting their consent and assent. We had to get permission from schools, so we got a written approval from all of the schools to collect the data. Of course, the study was approved by IRC within the country, and we also got permission from the students' parents to use collect the data from them and use it. So there was a little bit feasibility issue over there, but I think that should be okay because we were dealing with a vulnerable population. Other than that, I don't think there was an ethical issue. There was not any sensitive information that was collected from any participant in this study, and they were participants were also like very clearly told that it was voluntary and they could drop out at any time if they weren't comfortable with anything, any procedure or question.
Hmm. Yeah, it's always important to ensure ethical standards are maintained, especially when vulnerable population are involved. So now, as we wrap up, let's talk about the impact of the study. Since we conducted this study with all our efforts to bring some impact, could you share how you assessed the relevance of the study and whether you see its potential to influence practice or not?
Mhm. So our study demonstrated pretty positive response to implementation of this visual assessment chart in the schools. Students as well as teachers were pretty satisfied, and they perceived that it had health benefits. But however, when it came to like assessing the practice, I think the proper utilization, I mean, the accurate utilization of this chart was pretty limited. Only a small proportion of students were able to correctly use the chart. And then most school had like adequate placement of the chart. There was clear signs and instruction, but I think the use was pretty limited. So I think that it is it would be very helpful to do this kind of intervention, but at the same time, both students and teacher, they needed a little bit of reinforcement or motivation, or continuous education to use this chart. So both teachers and students, they acknowledge that the chart was beneficial,
Mhm.
but still I think it would be premature to rely on just using the visual assessment chart without adding on the awareness and motivation factor into this intervention to make it effective in larger scale.
Mhm. Yeah, that's really informative, and it's great to hear that our work is influencing and could lead to changes. So, personally, it was an incredible opportunity for me as well to be involved in this study and learn from it. So, as we wrap up, Dr. Archana, thank you once again for sharing your insight and experiences with us today.
Yeah, thank you so much, Lisasha. Very nice talking to you as usual.
Yeah, it's always a pleasure to learn from you. So, and to our listeners, thank you for tuning in to this episode of the JNMA podcast. If you have any question or thoughts on today's topic, feel free to reach out to us. Stay safe, stay informed, and we will catch you in the next episode. Goodbye.